benefits of the NAMUS membership is actually our Ask the Expert questions. Hi, Shannon DeConda here with NAMUS. Now, you may not be a member and you don't have to be, but I'm going to share one of the questions that was submitted to us by a NAMUS member, Carol, because it was a great Ask the Expert question. They have an emergency room leveling question that's related around chest pain and high complexity. And a lot of you may be thinking, oh, this is probably going to be a great question, and it is. So the data column, they're saying with most of their patients ends up being high due to the number of tests that are ordered to rule out any other complications. We are trying to determine the difference in chest pain in the emergency room when it is cardiac related and they don't know what the problem is versus having chest pain and getting a workup but then getting sent home because it is not cardiac related. I feel the cardiac issue would be a level 5 and the other issue for chest pain would be a level 4. Again, data having a hand in that. So remember that when we're looking at our levels of service under medical decision making, we do have those 3 columns in the emergency room under MDM we look at. The first being the complexity of the condition. When a patient comes in with chest pain and that chest pain is of unknown origin, of course we could consider that high complexity, depending of course upon how it is documented by the provider. The middle column, of course, may end up being high complexity because of what is ordered. Now remember, it can't just be because of what is ordered, because our order max, that is only category 1. And we will need more than just category 1 to hit high complexity in the middle column. It takes more than that. So make sure that it is not just orders that you're using to get to high in the middle column. It would take something else like discussing the issues with another provider or something else. So make sure you're really looking at column 2 to make sure that your data is hitting high. Now, moving to that third column, I think this is going to be the difference maker in whether this really is a level 5 or not, whether it's emergency room, inpatient, or office. A lot of times in our notes, what we're seeing these days is our physician's failure to take the last column in that treatment plan to the highest level it needs to. And that's because the last column is the risk of managing that patient. It's not just evaluating the treatment plan that was created by the provider. So if we're sending a patient home because it was not a cardiac incident, and we're sending them home, that's okay. That's still part of the treatment plan. Maybe we're even going to have them follow up with GI about the GERD. Those all are treatment plans, but what is the risk? What was the risk of treatment of that patient? What is the risk of ongoing patient management of that patient? All of that has to be articulated by the treating physician in order for us to provide that analysis to that encounter. Without having that risk documented in conjunction with that encounter, we may miss out on being able to bill that encounter as a level 5. It may absolutely support a lower level of service, maybe even as low as a level 3. Remember, page 14 of 2023 documentation guidelines states, the evaluation and treatment should be likely in presentation to the nature and complexity of the presenting problem. Those should balance. So this patient had chest complaints. They did have a lot of workup. Now that risk and management of that patient should also align with that high complexity if that patient truly is high complex. So within MDM of the 2021 documentation guidelines with the 2023 expansion, what we're trying to show is that all 3 columns are like a finely tuned instrument. They all work in sync. It doesn't mean they all have to hit the same levels of high, moderate, or low. What it means is if one is high, then they're all kind of working in fine-tune together. So I hope this kind of helps. Again, it always goes back to what is documented and how is that complexity demonstrated. So there's not a yes it will or no it won't answer to this question, but there is a question of you're just going to have to look at the documentation of each one of these encounters to see really which way does the encounter take you. I hope this is helpful, and I hope you'll check out those benefits of a NamUs membership and see if Ask the Expert would help you. For today, that's all I have for you. Check out these videos later. Have a great day.